Hey everyone, we are here today with Dr. Andrea Johnson, who is our alumni and graduate of the Arizona Dental School and our Masters of Public Health Dental Emphasis Program. Welcome, Andrea, and great to see you.
Thank you for having me.
I am Dr. Jana Gold. I am a chair and professor of the A.D. Still University Public Health Department. So here at the College of Graduate Health Studies and Public Health Department, we have three online programs. We have Masters of Public Health, Masters of Public Health in Dental Emphasis, and Dental Public Health Residence programs. And today I'm so pleased to talk with Andrea about our Masters of Public Health in Dental Emphasis program. So, Andrea, can you first introduce yourself and tell us what is your current role and where are you practicing?
Sure. My name is Annie Johnson, and I actually am a dental director for United Healthcare right now. I moved into the insurance world after several years of public health and clinical dentistry. And then I also am an adjunct faculty with the Masters of Public Health online program.
Yes, thank you. So what inspired you to choose our online program?
I really appreciated the flexibility that it offered. It is a program that is amenable to really anybody, whether you're a dental student or you're a dentist or you're a hygienist assistant, somebody who's thinking about getting into public health, likes dental, maybe wants to do dental someday. It's just really flexible and really works with people who have lives. When I went back, I already had 3 little babies, and so it was kind of one of those things that it's probably actually a little bit scarier for me than even going to dental school, because at that point I didn't have any kids, and now I had to care for them as well. And so the flexibility for me, to be able to go, you could take 1 class, you could take 2 classes at a time, kind of what works for your schedule. There is an order of certain classes you have to take, but you could do this one or that one. And so that was the part for me that was like, okay, I think I can make this happen with help. I was working and I had the kids and everything. So it was just something that I took a shot at, and it was actually really great. I never had any problems with it kind of meshing with my life.
Yes, it really provides flexibility for working mothers and any parents and anyone who is really working with other assignments. So was there any specific concentration or specialization or any unique features of the program that attracted you?
Well, I love the fact that there was a dental emphasis, because I was a dentist and I grew up in dental. And, even if I had some classmates who did it while they were in dental school, the fact that it was dentally driven was really great, because we got to apply our knowledge as a dentist and, look up research that carried over into our dental world as well. And all of public health is interesting, but when you're a dentist, you're a very unique breed that we like teeth, we like dental, we like that sort of thing. So that was the part of it for me that was the most attractive.
Exactly, and it's very unique nationally because not so many have dental emphasis.
Sure.
With public health. Great. So when you enrolled, what were your goals professionally or personally, and what were you hoping to gain from that experience?
I really wanted to gain more knowledge. I was so lucky to have gone to ASDO for dental school and was exposed to public health dentistry, which was not something, even though I grew up in dental, my dad was a dentist, I was very exposed to private practice dentistry. And so I wanted more knowledge. I wanted to know how I could do more or how I fit in, because, some people go all in. That's all they do is public health dentistry. Some people have it be part of their practice. Some people, different aspects of it. But we have such a shortage of dentists in the public health world, and not that you have to go all in, but I just wanted to know, what I could do to help and what my role was going to be to play in it. And then a little bit too. A lot of people kind of gave me a hard time, like, oh, you already have a doctorate degree. Why are you going back to school? And it was like, I got this. I can do this. I survived dental school. And so it was a little bit of pride too that kicked in. But it was all for the goal of, I have this unique skill. I can, fix people's teeth, but I have to be able to, I kind of believe like you reap what you sow. And so I wanted to figure out what my role was going to be to help out those that were in the most need. And I mean, the program exactly did that for me. So it worked.
Wonderful, wonderful to know hear that. So, how would you describe your overall experience as a student in the program?
It was great. I never had any, honestly, I don't really have any complaints. It was amenable. I thought all of my instructors were wonderful. I remember biostats was my least favorite course. And I remember my teacher she was like in Japan or somewhere overseas. And she was so great. She would be on during, US times, and she would do Zooms with us. And that was, of course, my first class back. So I was kind of trying to get back into school gear and jumped. I had that and another class I remember. So, and I like the fact I actually had a classmate of mine, a dental school classmate of mine, who did the classes with me. And that was also very helpful. I mean, it is a very individualized program, but being, having her kind of there with me. Plus, you get to know your classmates. I see, if I teach sequential classes, I'll see the same, students in one as students in the other. And so it was great kind of having that camaraderie too, to be able, because there's times you don't understand an assignment. You don't always want to be messaging your teacher like, what do they mean by this? What do they mean by, I don't need APA formatting, but do I still need to cite my references? Like, is that formatting, or what is that? And so, I liked the fact that I had the support that I needed. I felt to be very successful. And I thought the classes were challenging, but definitely doable. And especially with the support that I got.
Excellent. So you already mentioned that, as a mother, it's doing multiple things at the same time. It can be challenging. So can you just kind of elaborate that? Like, how did the online format support it or challenged your personal and professional commitments otherwise?
Sure. I think the thing, I have been involved in some other, online formatting, whether it's with my kids and taking college classes or, different things. The thing that's so unique about ours and so great is everything is online from the day that we start the class. So you have the syllabus, you have all the assignments, you have all of the reference manuals that you need to go look at. And so, I've had some students, and applicable for me too, that will message me and say, hey, during week 5, I'm taking a family vacation to Hawaii. What should I do? And I was like, well, work ahead. Like, you have all the material, and if you need help, ask me. But it's so flexible in terms of being able to work around whatever, some people are like, oh, I can't go back to school, that's during my kids' spring break, or that's during, like even Thanksgiving week. We take the whole week of Thanksgiving off because we're understanding that like people have lives and it's a holiday. And if you're a dental student, that's one of the first breaks you get during the whole first semester. And so, the flexibility to be able to make it work with my life it was, I mean, I never had a problem getting assignments done. And even now when I teach, even if I have students that are like, hey, during week 7, we're doing a Zoom presentation with you. I'm out of town that week. Should I do it before I leave or after I get back? And I'm like, it's fine, whatever you want to do. If you feel like you're not prepared before you go, because it's kind of a big lift, be ready to do it by this date when you get back. So, a lot of flexibility and just, kind of moldability to your schedule.
Right. The flexibility is really key for our online program. We always emphasize that with the faculty that we can provide flexibility to busy students, but also we have a low faculty student ratio. So there's a lot of interaction. So I think many students have been telling that that's really important. So let's focus any, if you have any specific course or project that really stand out as especially influential to you. Can you mention?
Sure. My practicum actually ended up being phenomenal. It's kind of one of those things where you don't know what to do, and it's a huge lift, and you want to make sure you pick the right thing, and because you're going to spend a lot of time with it. And so I was able to go do kind of a needs assessment at a juvenile detention center. It's like a kind of joint group home juvenile detention center here in Arizona. And in doing the needs assessment was my practicum, because you don't get to go in and do dentistry or anything like that. It's more of a, research. What could we do? Could this be a program? Is there a need here? Then you're going to back it up with all kinds of other research. But I did my needs assessment and determined there was a major need, and it actually ended up turning into us starting a public health clinic down there. So we went from these, a lot of these kids, they're all covered by the state. They all had state insurance because most of them were wards of the state, and they never got any dental care. And so they're down there. They're there all day long, every day. They have plenty of time to get dental done. Nobody just ever did it for them. So we started a dental clinic, and we were able to treat, my goal was 100%, unless they get pulled for some unknown reason. Sometimes they would leave unexpectedly, and that we couldn't predict. But my goal was we always knew their exit date, and we were always going to get their dental work done. Sometimes we saw them 3 times a week, because why not? Like they had the time. We wanted to make sure they were done. And so it's still there. The clinic is still there. It started out as a public health clinic, and then that company had to close during COVID. So I took it over as my own. And although it was a private practice, all we did was Medicaid. They were all Medicaid patients. And then, when I moved on to the career I'm in right now, somebody else took over the practice. So it's still going.
That's amazing. It's just amazing to hear that how practical project really influence your career, and really you were able to get some important and integral skills
Yeah.
from the program. That's wonderful. So let's elaborate a little bit from that. So how this earning this degree really influence your career or enhance your practice, and just give another example of how you apply all these learned skills and knowledge in your day-to-day work or decision making.
Yeah, ultimately, I gained more knowledge, and more knowledge is always key, whether you're in an interview or, in conversations, with other dentists. Um, but really, everything that I'm doing right now has been influenced by my MPH. We all go to dental school. We all have the ability to work whatever capacity that we want, but my ability to teach in the MPH program, I wouldn't be able to do that if I didn't have my MPH. My current position that I have, working in the insurance industry, it's a pretty competitive field, and I know that me having the MPH was a leg up over everybody else, that interviewed and wanted the same position. And so that also, I can't say that it got me the job, but it definitely was helpful in, my understanding of public health, Medicaid, Medicare, because that's a lot of our members is that population. And then, it's just a unique, I'm uniquely different than most dentists that I know. A lot of them, don't have the MPH. So for me, it has just been a little boost throughout my career ever since getting it. Now it's been like 8 or 9 years since I've had the MPH, and really good career changes have come because of it.
Oh, that's amazing. And it really sounds like this gaining this degree really gave you that leadership role you are right now, and promoted you. And so do you feel like this degree elevated your credibility in your profession, and overall effectiveness in your field?
Oh, absolutely. Yeah. I actually just was on a call yesterday, and we were looking at public member facing documents that we had on our webpage, and they were saying, it was some maternal and infant health documentation that was on there, and they're like, Dr. Johnson, what do you think? Should we keep this? Should we get rid of it? Should we look? I said, let me see if there's anything better out there that I can find. I like this. It had a big listing of medications that you should not take during pregnancy, and how to take care of your baby after the baby's born with their teeth. But I definitely feel that, when it comes to reading stuff like that, especially if it comes, kind of from a public health facing side, I'm the go-to. I'm the person that they ask, if I think that we should change it or keep it, or what my opinion is. So yeah, I definitely think that having that it does. I mean, I do know more, right? I went through several classes, and I'm glad that, they understand that and they use me as a reference.
This is amazing. This is such a wonderful to hear. So my last question is really, what would you say to any potential student, dental student, or someone who has been practicing already for some years, or what would be your recommendation why they would consider this online program?
My recommendation is just to go for it, honestly. Like, if you think that you should, you should. I know when I thought that, I kind of hesitated a little bit, and I had some people kind of chirping in my ear, like, why are you going to do that? You already have a doctorate degree. Is that really necessary? But I'm so glad that I did. I'm so glad I didn't listen to him. I'm so glad I didn't, kind of, what about this? What about that? Am I going to be able to fit it in the timeline wise? It was such a great decision. And, we're always willing to work with students. I actually had a class that just started last week, the intro class, and there was, turns out she is a dentist, and she joined late. Like, she decided to enroll a little bit late. She didn't start until like Tuesday or Wednesday of the quarter. And, right away, academic advisor reached out. Hey, Dr. Johnson, she started late, but she's going to do it. She's a little anxious about this. She hasn't done the online platform before. Can you work with her? Can we give her an extension for the first week? I said, yeah, absolutely. Like, just, call me if you need help. This is what you need to do. We will help you. And she wrote back and she said, thank you so much. She said, I'm so nervous about starting this, but I know that I really want to. So you encouraging me and telling me that I can have an extension on the time frame is so helpful. And I can already tell, like, from the first week to the second week, the comfort level with her posts and how she's communicating with her classmates. So, I mean, and she's a dentist. She went to dental school. There's always going to kind of be nerves and the what ifs there. But, once you start, it's a well put together program. I've seen other online platforms, and all of them are good, but I really like ours, and the way that we ramp up, and we, how we have everybody kind of learning from the beginning to the end. I think that it's helpful to the students. We're not jumping in and being like, write a 15-page paper. No, that's not happening right away. Like, we're going through and making sure you're comfortable with everything before we move on to higher level classes, and by then you'll be comfortable with it. So go for it. That's what you should do. Just go for it. That's
great. So yeah, our program has changed a lot from the time you were a student, but you know that because you are actually an adjunct also and teaching for us part-time, but it's not only discussions and papers anymore. We have so many different things what we do. Students do presentations and flyers, and they track letters and things like that. So thank you so much, Dr. Johnson. This was wonderful. Thank you for your time. And I'm so happy that everything worked out for you, and you have a wonderful career, and you are a mother, and you are working so hard. So thank you so much for your time.
Yeah, of course. Thank you.